What do pediatric systolic and diastolic BP mean? Imagine your child's blood pressure as the force of water flowing through a hose. When the water pushes hardest against the hose walls, that's like the systolic pressure. When the water is flowing gently and the pressure drops, that's the diastolic. In children, these numbers tell us how strongly blood is pushing against their arteries during different parts of their heartbeat. The top number, called systolic blood pressure, measures the pressure when the heart squeezes and pumps blood out. The bottom number, diastolic blood pressure, shows the pressure when the heart is resting between beats. Children's blood pressure isn't the same for everyone. It changes based on their age, size, and sex. For example, a 5-year-old might have a systolic pressure around 110 millimeters of mercury and a diastolic around 70. An older child or teenager might have readings closer to 120/80. Blood pressure naturally goes up and down during the day. It can be higher when kids are active or stressed and lower when they are resting. That's why doctors look at these numbers over time and compare them to what is normal for their age and size. In children, we use special charts called percentiles to see if their blood pressure is healthy. If a child's systolic or diastolic number is at or above the 95th percentile for their age, sex, and height, they are considered to have high blood pressure or hypertension. If their numbers are between the 85th and 95th percentile, they are in a prohypertensive state, meaning they might be at risk. For teenagers 13 years and older, the numbers are similar to adult standards. If their systolic pressure reaches or exceeds 130 millimeters of mercury or their diastolic hits or goes above 80, they may have hypertension. Measuring blood pressure in children involves using a cuff around the arm and a device that either listens to the blood flow sounds or automatically detects the pressure. The first sound heard as the cuff deflates is the systolic pressure. When the sound disappears, that indicates the diastolic pressure. Understanding what these numbers mean helps in catching high blood pressure early. If a child's blood pressure stays high over time, it can lead to health problems like heart or kidney issues later in life. That's why regular checkups and careful monitoring are so important. In living with hypertension, knowing these numbers helps parents and doctors decide on the best steps to keep a child's blood pressure in a healthy range. Special considerations include how growth, activity level, and overall health can influence these readings. Managing childhood hypertension early can make a big difference in their future health. So, pediatric systolic and diastolic blood pressures are more than just numbers. They show how hard blood pushes against arteries during different parts of the heartbeat. By understanding these measurements and how they relate to age and size, we can better support children living with hypertension and help prevent long-term health issues.